Welcome back to the Wound Talk series from Molnica. Mary is happy and almost free from the pain and discomfort her wound was causing at the beginning of the healing process. And with the end in sight, she's excited about the prospect of her wound healing fully. In the previous episode, we learned about the 7th of our 10 essentials, taking care of the peri-wound and surrounding skin. We're nearing the finish line now, and on to essential 8, controlling edema. There may be several possible causes that lead to edema, and the underlying reasons should be investigated individually. In Mary's case, her venous disease has led to the development of a lower leg edema. Controlling edema is important for several reasons, one of which is because it can delay wound healing. Edema can also cause complications, such as pain, mobility problems, and stiffness of the skin. Edema can also decrease blood circulation and lead to swelling, causing less oxygen to be delivered to the cells in the affected areas. This increases the risk of infection. Additionally, chronic venous insufficiency can lead to lipodermatous sclerosis, hyperpigmentation, and venous eczema. Untreated edema resulting from venous disease can cause the wound to deteriorate and can take us back to a situation with excess exudate and increased risk of infection. And if you remember, excess exudate and infection can be an impediment to wound healing. But there are ways to treat lower leg edema caused by venous disease. The gold standard treatment is correctly applied graduated compression therapy. So not only can an individual compression therapy reduce venous leg ulcer recurrence, it can also improve healing rates in patients with existing venous leg ulcers. And with that, we have completed 8 out of our 10 essentials. And Mary is almost back to her normal, cheery self. Now that we have explored why controlling edema is important, let's take a look at how we implement this knowledge into practice before we move on to our next essential, managing cavities and fistulae.